or someone in your family has recently undergone open heart surgery, the days after discharge can feel confusing, stressful, and even frightening. But what I want you to understand first is this. Recovery at home is not just about resting, it is about healing actively, safely, and intelligently. Because what you do every single day during the first 6 to 12 weeks can significantly decide how strong your heart becomes for the rest of your life. So think of this period as rehabilitation, not limitation, and let me walk you through exactly how I guide my own patients and even my own family members after surgery, starting with the most important principle, which is protecting your chest and sternum. Because during open heart surgery your breastbone is opened and wired back together, and it needs time to heal just like a fracture, which means no heavy lifting, no pushing or pulling heavy doors, no sudden twisting, and no lifting more than 2 to 3 kilograms for at least 6 weeks. And whenever you get up from bed or a chair, use your legs instead of your arms. Hold a pillow gently against your chest to reduce discomfort, and move slowly and deliberately, because protecting your chest bone prevents complications that can delay healing for months. And next comes walking, which I consider the single most powerful medicine after surgery, because gentle walking improves circulation, prevents blood clots, strengthens the lungs, reduces pneumonia risk, improves mood, and slowly rebuilds heart stamina. So start with just 5 to 10 minutes twice a day inside your home, and gradually increase by 2 to 3 minutes every few days until you comfortably reach 30 minutes daily. And remember, you should be able to talk while walking. If you are gasping, you are going too fast, and consistency matters more than speed. And along with walking, breathing exercises are absolutely essential, because anesthesia and surgery make the lungs weakened. Shallow breathing can cause infections, so use your incentive spirometer if provided. Take slow deep breaths several times every hour. Practice gentle coughing while hugging a pillow to clear mucus, and make lung expansion part of your routine morning and evening. And now let's talk about wound care, because infections are one of the main reasons patients return to hospital. So keep your incision clean and dry. Wash gently with mild soap and water. Avoid applying powders or creams unless prescribed. Look daily for redness, swelling, discharge, or fever, and report any changes early rather than waiting, because early treatment prevents serious complications. And equally important is medication discipline, which many patients underestimate. But missing doses of blood thinners, beta blockers, or cholesterol medicines can be dangerous. So use a pill organizer, set alarms, follow timing strictly, and never stop medication without consulting your doctor, because these medicines protect your heart while it heals. And now let's focus on diet, because food after surgery is not just nutrition, it is therapy. And your plate should be colorful and heart-friendly, with vegetables, fruits, whole grains, dal, oats, fish, nuts, and healthy oils like olive or mustard oil, while avoiding fried foods, processed snacks, excess salt, sweets, and red meat, because reducing salt prevents fluid retention and high blood pressure, and lowering saturated fats protects your grafts and arteries. And small frequent meals are better than heavy meals, because digestion also consumes energy, and hydration is equally important unless fluid restriction is advised. And don't forget protein, because it helps tissue repair. So include lentils, eggs, tofu, paneer in moderation, or fish to support healing. And next I want to talk about sleep and rest, because your body heals during sleep. But many patients struggle with discomfort or anxiety. So use pillows to support your back. Avoid sleeping on your stomach. Maintain a regular sleep schedule. Reduce screen time before bed. And take short daytime naps if needed, but avoid long daytime sleeping that disturbs night rest. And beyond the physical side, emotional health plays a huge role, because it is very common after heart surgery to feel low mood, fear, or irritability, and many patients silently think something is wrong with them. But this is completely normal due to stress hormones and the trauma of surgery, so talk openly. With family, practice relaxation, meditation, or prayer, listen to calming music, and if sadness persists, seek professional help because mental recovery supports physical recovery. And let's also discuss daily activities, because patients often ask when they can return to normal life. So light household tasks are fine after 2 weeks, driving usually after 4 to 6 weeks depending on comfort and reflexes. Climbing stairs slowly is acceptable with support, and sexual activity can usually resume once you can climb 2 flights of stairs without breathlessness, but always follow your doctor's personalized advice, and always monitor warning signs like chest pain, severe breathlessness, irregular heartbeat, swelling of legs, sudden weight gain, or fever, because these require immediate medical attention. And do not ignore symptoms hoping they will disappear. And finally, I want you to understand that recovery is not a race but a journey. Small daily improvements compound into big strength over time, so celebrate each step, each walk, each healthy meal, and each medication taken correctly, because every small action protects your heart. And if you follow these simple structured habits consistently, most patients not only recover fully but often feel healthier than they did before surgery. And that is my goal for you. Not just survival, but a stronger, safer, and more energetic life ahead. So take it one day at a time, trust the process, stay disciplined, and remember, your heart has been repaired. Now it's your turn to protect it.